Welcome to the Cenario Podcast, your guide to mental health and well-being. Each episode, we uncover practical tools, discuss expert insights, and explore how supplements can transform your mental health journey. Get ready to learn, grow, and thrive with us.
You know that feeling, right? When you're driving a route you take, like every single day, maybe driving home from work, and suddenly you kind of snap back, and you realize you don't actually remember the last 5, maybe even 10 minutes of the trip.
Yeah.
It's like your body was driving the car, sure, but your mind was just completely on autopilot, checked out, somewhere else entirely. People call it highway hypnosis.
And, that moment, that little bit of zoning out, it's actually a perfect place for us to start today. Because that brief, pretty minor mental disconnect, well, it's on the very same spectrum as severe clinical dissociation.
Okay, let's unpack this then. So dissociation, fundamentally, it's a mental process. A person disconnects from their thoughts, feelings, memories, sometimes even their sense of who they are. So our mission today in this deep dive is to really look at the sources you've brought and help you, the listener, map out that spectrum. We want to make it clear, what's the difference between those typical harmless moments we all have and when this disconnection thing becomes a chronic, disruptive clinical disorder.
And understanding that boundary is it's essential, really. Because while almost everyone will experience mild dissociation at some point, the critical thing is knowing when it stops being just a temporary way of coping.
Right.
And starts seriously getting in the way of your ability to just, live your daily life.
Okay, so let's ground ourselves first in those typical mild experiences. These are the common things the sources say they're, generally harmless, just short episodes, losing a bit of time, but no lasting issues.
Exactly. Think about getting so lost in a really good book or maybe a movie that you completely lose track of time.
Yeah, happens all the time.
Or you don't even hear someone calling your name right next to you. Or maybe that student daydreaming in class.
Right.
And they missed something important, the teacher said.
Okay.
These kinds of things are occasional, they're brief, and honestly, they have a pretty minimal, forgettable impact on your day.
Right. So contrast that for us then. What about the severe, the clinical side? What's the marker that shifts it from just, zoning out occasionally to a significant medical issue?
Well, the contrast is, it's pretty dramatic, actually. Mild dissociation, we usually measure that in moments, maybe minutes. Clinical dissociation, that's persistent, it's frequent. And it causes immense disruption in someone's life.
Immense disruption? Like what specifically?
We're talking about serious, repeated memory problems that go way beyond just, everyday forgetting where you put your keys.
Okay.
Or significant identity confusion, feeling chronically detached, things that stop you from being able to work or maintain relationships. You basically shifted from missing 5 minutes of a lecture to potentially losing whole days or more of your life without memory.
Wow. Okay, that's a huge difference. Okay, here's where it gets really interesting for me. We have to talk about why. Why does the brain even do this? It sounds like a major problem, but you're saying it starts as, what, a defense mechanism?
That's exactly it. It's fundamentally about protection.
But if it's protecting itself, why does it feel so horrible or scary when it happens later? Can the protection actually end up being worse than whatever it was protecting you from originally?
That really is the paradox of dissociation, isn't it?
Yeah.
In that immediate moment, that moment of overwhelming stress or often trauma, the brain literally checks out. It can't physically escape, so it creates mental distance.
Oh.
It does this to reduce the emotional pain when there's no other way out. It's a very primal emergency coping strategy.
An emergency brake for the mind.
Sort of, yeah.
Yeah.
And while that mental escape can be really adaptive short term, it helps you survive something awful, it often becomes a long-term problem.
How so?
Well, our sources point out that this defense mechanism can get stuck. It becomes so ingrained that it keeps happening for years, maybe decades, even after the original trauma is over.
Oh, wow.
So it masks the pain, sure, but it also stops you from ever really processing it and healing. And its presence, long-term, can be a sign of underlying conditions like PTSD, chronic depression, or severe anxiety disorders.
That makes a scary amount of sense. The mind checks out because the body can't, but then it gets stuck in that checked out mode. So besides severe trauma, especially in childhood, which gets mentioned a lot, what else can trigger this state?
Trauma and abuse, particularly those early life experiences, they're definitely the primary drivers we see. But dissociation can also be triggered by, say, acute stress, intense panic attacks, even the use of some psychoactive substances.
Okay.
And interestingly, it also occurs in non-pathological states. Think about certain cultural or spiritual rituals that involve deep meditation or trance states.
So the mechanism itself isn't the bad guy.
Exactly. It's the context, the frequency, and the level of disruption that tells us if it's crossed the line.
So once that defense mechanism does get stuck, becomes chronic, what are the red flags? What symptoms tell you this has gone beyond manageable coping and might need, clinical attention?
Well, the biggest flag, probably, is persistent memory loss.
Yeah.
But specifically memory loss about important personal information, key life events, or traumatic experiences themselves. It's not just forgetting where you parked.
Right? Much bigger gaps.
Much bigger. Another really striking symptom is that feeling. That feeling of watching yourself from outside your body, like an out-of-body experience, but happening repeatedly or for long periods.
Okay, yeah, that sounds unsettling. The sources also keep mentioning these two key terms. They sound so similar. Depersonalization and derealization. The D words, how can we actually tell them apart? Make it stick for someone listening.
Yeah, they are definitely the core feelings of clinical detachment. And they can sound alike, but the distinction is actually pretty simple once you frame it right. One is focused inward, on you, and the other is focused outward, on the world.
Okay. Inward versus outward.
Right. So depersonalization, that's the internal detachment. It's the feeling that you are not real, or that you're disconnected from your own body, your thoughts, your feelings.
Like you're watching a movie of yourself.
Exactly. Or operating a machine like a faulty robot suit. That feeling that your own actions aren't fully yours.
Got it. So depersonalization, the alien feeling is you.
Precisely. And derealization is the external detachment. This is when the world around you feels strange or distant or unreal, dreamlike maybe.
How so?
Like you're living behind a pane of glass, maybe slightly foggy glass, or things look flat, lifeless. People you know might seem unfamiliar, almost like mannequins or cardboard cutouts.
Okay. So derealization, the alien feeling is the world. That clicks. That really helps. Our sources also mention persistent emotional numbness, just feeling cut off from feelings altogether, and identity confusion, too. Not feeling like yourself, or maybe feeling like you're someone else entirely. Those are also key signs, right?
Absolutely. Those are major indicators, too, often going hand in hand with depersonalization and derealization when it becomes a clinical issue.
Okay, so when these symptoms become severe, persistent, the psychiatric community groups them into three main classifications, right? Based on the DSM-5 diagnostic manual. Let's look at how this breakdown actually looks in practice.
Right. These classifications really just describe how the severe dissociation is presenting itself. What's the dominant feature?
So what's the first one?
First, we have dissociative identity disorder, or DID. This used to be known as multiple personality disorder. When we talk about two or more distinct identities or personality states taking control of the person's behavior, what that really looks like is sudden, often dramatic shifts, changes in behavior, voice, temperament, memories.
And memory gaps.
Huge memory gaps, yeah. Significant time loss, where the primary identity has no recollection of what happened when another identity was out. And this one is profoundly linked to severe repetitive childhood trauma. That splitting off of identity states was fundamentally a survival technique that got stuck.
Okay, wow. And the second way these memory gaps show up?
That leads us to dissociative amnesia. This is primarily about memory loss. A person struggles to recall crucial personal information or details about traumatic events. And importantly, it's not just ordinary forgetting.
It's like the memory is blocked.
It's inaccessible, yes. Not because they're faking it, the memory is genuinely blocked off. And the duration, it can be terrifying. The memory loss might last minutes or hours, but in some severe, though rarer cases, it can last for years. They might forget huge chunks of their life story.
Years. Incredible. And the third classification, that one seems to focus specifically on those D words we just talked about, the detachment from reality.
Exactly. That's depersonalization,
Yeah.
derealization disorder. So if those constant or recurring feelings of being detached from yourself, depersonalization, or feeling like the world around you is unreal, derealization, if those are the main persistent features causing distress.
If that foggy glass feeling just doesn't really lift.
Right. If that becomes the defining, ongoing experience and it's causing significant problems in your life, that's the diagnosis. It's when those feelings of unreality become chronic and central.
Okay, this is definitely heavy stuff. So how do people manage this? How do you pull back from this edge? When do you know it's time to move from just, trying to shake it off to needing professional help?
That's a crucial question. Basically, when the episodes are happening frequently, when they're causing you genuine distress or fear, and this is key, when they start interfering with your ability to function.
Like holding down a job or relationships.
It's exactly.
Yeah.
Holding down a job, maintaining relationships, just managing daily tasks. If the dissociation is getting in the way of those things, professional help is strongly recommended. That level of disconnection usually means the underlying trauma or stress is just overwhelming your system's capacity to cope.
Right. And since it's so often rooted in that unresolved trauma, psychotherapy seems to be the main approach. Can you maybe clarify a bit about those common methods mentioned in the sources like CBT and EMDR? What do they actually do?
Absolutely. The core goal of therapy here is usually twofold. Address the underlying trauma safely and change the thought patterns that trigger the dissociation.
Okay.
So, cognitive behavioral therapy, CBT, that helps you identify the specific thoughts, feelings, and situations that tend to lead to dissociative episodes. And then you learn skills to change those thought patterns and your responses.
Makes sense. Identify and redirect.
Pretty much. And then eye movement desensitization and reprocessing, EMDR. This is a technique specifically designed to help process traumatic memories. It uses bilateral stimulation, often eye movements, to help your brain safely file away those distressing memories so they lose their emotional charge.
So they stop triggering that need to check out.
Precisely. It reduces their power to overwhelm you in the present.
Okay. So while someone is working through therapy, which sounds like it can take time, what about in the moment? What are those immediate practical tools people can use when they feel themselves starting to detach or feel unreal?
Yeah, that's where grounding techniques are absolutely essential. They're like first aid for dissociation.
First aid, I like that.
They are techniques specifically designed to anchor you back into the present moment, right here, right now. They do that by forcing your attention onto your physical senses and your immediate environment. They're an immediate counterpunch to feeling spaced out.
The sources gave some really good practical examples, like holding a cold object, maybe ice.
Yes, the strong physical sensation helps. Or listening intently to specific sounds around you, naming them. Smelling something strong, like peppermint oil or coffee grounds.
Or even just describing everything you can see in the room, right? Colors, textures, shapes, the light.
Exactly. Anything that pulls your focus out of your internal state and forces it onto concrete, external reality. It literally helps reroute your attention.
Okay, one last thing on treatment. Medication. What's the role there? Is there a pill for dissociation?
That's important to clarify. Generally, no, there isn't a specific medication for dissociation itself. It's not like taking an antibiotic for an infection.
Right.
Instead, medication is often used to treat the related underlying conditions that frequently co-occur with dissociation. Things like severe anxiety, depression, or PTSD.
So it treats the co-occurring stuff, not the dissociation directly.
Correct. By stabilizing mood, reducing anxiety, or managing depressive symptoms with medication, it can make it much easier for the person to engage in and benefit from the crucial work of therapy. But the treatment plan always needs to be personalized. Always. Because just like the experiences that might lead to it, every person's experience of dissociation is unique. #outro.
Wow. Okay, this has been a really crucial deep dive. We started with something as common, almost mundane, as losing time while driving, that highway hypnosis. And we've mapped it all the way to these complex clinical conditions. But the core idea seems to be that dissociation starts as the brain's incredible emergency brake, a coping mechanism designed purely to protect us from overwhelming stress or trauma.
Exactly. It's adaptive, initially. But when that brake gets stuck on, essentially, when it causes persistent memory loss, that severe emotional numbness, or deep confusion about who you even are, that's when it signals a deeper issue needing attention.
But the powerful takeaway here, I think, is that recovery is possible. Finding support through targeted therapy, learning those grounding strategies, it can make a huge difference regardless of where you fall on that spectrum.
Absolutely. And building on that point, let's leave you, our listener, with a final thought to kind of mull over.
Okay.
Given that we know mild forms of dissociation, like intense focus, getting lost in a task, even trance states in certain rituals are actually pretty common and sometimes even culturally valued. How might our modern world, hyperstimulated, always on, how might that be contributing to the sheer frequency of mild dissociation we all experience?
Like we're constantly overloaded, so we check out more often.
Could be. Are we maybe so overstressed, so overscheduled that we're constantly, maybe subconsciously, seeking these little moments of checking out? And could this easy, almost constant mild escape, could it actually be masking a deeper need, a need to address underlying stress before it potentially escalates towards something more clinically severe?
That's a really potent question.
It's just something to consider. Maybe take a moment this week, be a bit more mindful,
and just notice, where do you fall on that spectrum day to day?
Thanks for tuning in to the Cenario podcast. Don't forget to visit Cenario.com for more expert tips, articles, and supplements designed to support your mental health. If you enjoyed this episode, remember to subscribe and share it with a friend. Until next time, take care of yourself.